Hi everyone, this is Dr. Demchenko, neurologist, vertebrologist, osteopathic physician, chiropractor, sports medicine, and rehabilitation physician. And today we will talk about sciatic nerve impingement. The thing is, in common speech, very often the pain in the waist area, which goes down the leg, is called a pinch of the sciatic nerve. In reality, there are many reasons for such pain, and the first thing to determine is whether you really have sciatic nerve pain, whether there really is inflammation of the nerve, or whether it is pain that radiates from the joints of the spine or sacroiliac joints. To do this, you need to check yourself on several points. The first is whether the pain comes down lower than the knee joint. Sciatic nerve pain will always go below the knee joint. Second, if you have specifically neurological symptoms, that is, weakness in the muscles of the foot, tingling, numbness, and shooting pain. But if the pain is in the waist, in the buttock area, or as far as the knee joint, it probably has nothing to do with a pinched sciatic nerve. We will show you some very effective exercises that you can use to reduce the pain and get yourself in a better shape. The first source of pain can be the sacroiliac joint. It's the joint between the sacrum, the five-jointed vertebrae, and the pelvic bone. Here it is. What kind of symptoms does it usually produce? They are pain when standing for a long time, walking pain, lighter when lying down and sitting. There is also often pain when switching from sitting to standing. How can you differentiate if your pain originates exactly from the cruciate iliac joint and treat it? For this, we will do a special exercise intended to relieve pain in the sacroiliac joint. My friend Michael, a physical therapy instructor and rehabilitation therapist, will help me do this. Before performing the exercise, it is important to test the range of movement in your lower back. To do this, slowly, gently bend downward until you feel painful symptoms, if any. Feet at shoulder width, slowly lower yourself down. It is important to lower your head down as well, so that your spine is nicely stretched, and to standardize the position of your feet so that you could reproduce this test next time in the same way. Lift back up slowly as well, to see if any of the symptoms appear on the return, since very often it does not hurt to go down, but it does hurt to go up. The next test is the backward flexion. To do this, put your hands on your buttocks, and without using your knees, begin to slowly bend backwards in the waist area until you experience a painful sensation. If you are unable to reproduce painful sensations in either the bend or the flexion, you can try a more complicated test. To do this, bend back again. Go into rotation, that is, turn to the painful side, and try bending a little more. This movement quite often reproduces the painful sensation. Next, to do a side bend, stand in a neutral stance and slide your hand along your hip to one side and to the other as low as you can get it. A good result would be that we replicated the pain that is bothering you. Why? Because after doing the exercise, we should retest and see if we were able to affect the pain that is bothering us with this particular exercise. Next, lie down on the floor. We can use a gymnastic mat for that. Grab your leg from the side of the pain and pull it up to your chest, slightly past your shoulder. While pulling up, exhale in order to bring the leg deeper. Do 10-15 such motions. A good feeling during this motion should be a feeling of tissues stretching. If you feel a little pain in your lower back and sacroiliac articulation or in the leg area, then go as far as the pain and pull away. Again, a good sign would be if the pain decreases as you increase the number of repetitions. After 10-15 repetitions, gently stand on your feet, preferably over the side, without any sudden movements, and be sure to double-check the test motion. You don't need to retest all the test motions. Retest only those test motions in which you were able to reproduce the pain. If the pain has decreased or disappeared, then the chance that your pain was coming from the sacroiliac joint is very high, which means that you need to do these exercises 3 times a day. If the pain is severe, you can do 5-7 times a day with 10-15 repetitions for 7-10 days until the pain completely disappears. If these exercises did not help you, then you might be dealing with the pars muscle. And now we are going to look at a couple of exercises to fight this problem. For this exercise, lie on your stomach so that your legs are slightly apart and your heels are facing outward. Place your hands as if you want to do push-ups. Now you need to lift your body without lifting your pelvis off the ground. It is very important that your back and bottom are completely relaxed. If you feel pain while lifting, just touch this pain and move back. Perform 10 such lifts. It would be a good sign if with each repetitive ascent you could go a little higher and the pain would sort of blur away a little. After 10 of these lifts, stand gently on your feet and retest your symptoms. For example, if it was painful for you to bend down, try leaning forward. If you feel better or not worse, you can try an advanced exercise. Also, lie down on your stomach and try moving your pelvis away from the pain, or sort of squeeze your lower back a little on the side where the pain occurs. For example, right now Michael is giving an example as if the side of the pain is on the right. Do 10 lifts in this position as well. To reiterate, a very important component here is the inclusion of only arms. The back and buttocks must be fully relaxed. This is very important for the correct execution of the exercise. After doing 10 repetitions, again, we need to stand up and see how your symptoms are behaving. If the problem is with the pars muscle, you need to stretch and loosen it with a tennis ball. For stretching the sternum muscle, you can use the following position. Stand on all fours, pass the leg on the sore side like this, and try to lower your torso down. The second leg is stretched out. The arms go slightly forward. The body moves towards the mat. You should feel a stretch in the gluteal area. You can perform the exercise dynamically, or you can do statics for 40 seconds. You can also add an element of post-isometric relaxation. That is, a special phenomenon where muscles can relax even more. To do this, start pressing with your bent leg into the floor, as if trying to lift yourself off the mat a little bit, but not so much as to lift yourself up. Hold the pressure for 5-7 seconds and with an exhale, pull away. Each time you will be able to move lower and lower. You can make 2-3 repetitions. The next technique to work with the pars muscle is to squeeze it with a tennis ball. Set the tennis ball so that it hits the projection of the sternum muscle. Mikhail will now show you where it is. This area is usually more tense and painful when palpated. Next, place the ball on this area and slowly work this area. If the pain is too intense, you can use more support points or keep the ball in one place without moving. This way, you can wait for the pain to dissipate a little. This usually takes 1.5, sometimes 2 minutes. When the pain goes away in one of the points, try to move the ball a little higher or lower and find the intense pain point again, and in the same way press it for 1.5, 2 minutes. After squeezing and stretching the pear-shaped muscle, recheck the original symptoms again. If these exercises helped you with your pain, subscribe to the channel, place your likes, push the bell button. It motivates us to make new videos. Also, in the comments, write what exercises or solutions to what problems you would like to see. This is Dr. Demchenko and Misha. Good health to you.